doing something that maybe couldn't normally be done or nobody has taken an interest at. I like giving back to the ones that nobody wants.
Let me introduce myself to you. This is who I am. No more, no less.
Sponsored by
Hi, welcome to Seeing the Need, Finding the Solution. I'm your host, Phil McIlveen, coming to the end of a really long, intensive run on Where Do We Go From Here? Mental Illness 2012. And one of the questions we had last year from a guest who is on our show again, is no stranger, was last time Richard Clarke, CEO of Magellan Health Services of Arizona, we're talking about integrated healthcare clinics. Welcome, Richard. How are you doing?
Yeah, welcome, Phil. Thanks for having us back.
So what's happened since then?
Well, there's just been a tremendous amount of things going on. And when we came the last time, we talked about the issue of individuals that are facing the challenges of a serious mental illness dying 25 to 32 years earlier than the general population. And that's a product of a number of things like suicide rates being 6 to 12 times greater than the general population, and 70% of the individuals with these challenges having one chronic comorbid condition like pulmonary diseases or diabetes or heart disease or obesity or substance use. And our goal in early 2011, along with the governor, was to launch an integrated health home initiative in which we would be bringing together physical health services at the same location that an individual is receiving their behavioral health services. A complete care, the expression. People in one place can get all their care needs met, and the goal being to improve a person's life expectancy, their health, and their wellness.
Awesome. And you've successfully done that in a massive amount of work in a short amount of time as well, too.
Well, we have 4 clinics up and running now with Maricopa Integrated Health Systems, Choices Provider Network, People of Color Network, Partners in Recovery, and Southwest Network. And I'm just really excited to be here with a couple of your guests who are just extraordinary people, John and Hattisha and their support teams.
As well. And with that support team, we'll introduce to my right over here, which is Mary. Mary comes from background, obviously, in mental health. And Mary Deffenbaugh, Director of Nursing from Choices Network. Welcome.
Thank you, Phil.
Mary, I'm going to let you kind of feed yourself in a little bit and then introduce your guest as well.
Thank you very much. We at Choices are really excited about this partnership that we have. For so long, as Dr. Clarke was saying, the physical side of our clients has suffered. You know, we take care of the mental health, but now we have a primary care right within our clinic, so that not only our clients can come in and see their psychiatrist, they can see their mental health nurse, and we can take them right around the corner to the primary care clinic. So we are fulfilling both. You know, the nurses at Choices are expert clinicians in mental health, but they also have the background in physical health. And to have that partnership is just astounding. And I just look forward to it being in all of our clinics, so all of our consumers can reap the benefits of what is occurring.
You know, and for the guy that coming in from Idaho to the 190-degree weather here who doesn't know what all this has been about, you know, traditionally a client needing services has had to go to different facilities to get their care, one over on one area, one in another, primary care over here, psychological here. And now with what you're talking about is everything's been condensed into one area to make it more easy for the client, more productive for services, and sounds like you guys are doing an amazing, amazing job.
I like to call it one-stop shopping.
There you go.
They can get all their care at one visit.
Speaking
So-
of shopping, we have a shopper that shops where you guys are talking about. Our special guest today is John Padgett. He's one of the recipients from Integrated Home Health Services at Choices Network South Central Clinic. Welcome, John. How are you?
Doing good, you?
I'm very well. We talked a little bit before the show of some of the things that you've experienced and some of the things that are on your heart. When you began over at the clinic, where did you come from? I mean, how was that for you?
Well, I actually come from Mississippi. At one point in time, moved out here. Heard there was a whole lot of jobs and whatnot. Turned out to being a farce. And right now, with the clinic and everything, they're helping me. I was homeless at Cass for a little while, and now with it also, they have gotten me into a home, and it's been a real blessing. I get everything in one place, and it takes a lot of the stress out of it. And that with the therapy is the main thing, the most important is reducing stress. And that's the best road to recovery. So.
One of the stressors we talked about that you experienced before was that ability or inability to be able to be transported to those facilities for your appointments,
Right.
and how that you've the new integrated home health care clinics, and how's that transition been for you in reducing stress and being able to be transported there?
It's really nice because I didn't know where it was in the beginning, and so they were really nice and had some people come out and pick me up and literally take me to the clinic there. It was very beneficial to me.
And you talked about counseling being one of the primary important parts of recovery, but up and above that, you have some issues going on with your back we were talking
Yes.
about. And what is one of the benefits of the new clinic that you actually see a primary care physician
Right.
while you're there? That's got to be really neat for you. How's that experience?
The experience is great. Before, I had to go to several different places to try to get my care. With the primary care physician I had before, I didn't even know where he was, how to spell his name or anything like that, which made it very difficult. And they told me about this program they had coming up to where they were going to put everything in one place right there at my mental health clinic. It's been a whole lot easier.
Wow, what a big stress relief for you
Oh, yeah.
as well. And one thing I wanted to ask you is, for the person out there that is at the place where you were, where maybe they're not at that clinic yet, maybe they're still struggling with more stress trying to get that transportation to get there, what would you tell them about your experience?
I would tell them that definitely take advantage of what they're offering. Make a phone call. If you have services with Magellan, call your case manager. They can get you all the information that you need to be able to get there and get it done. But take advantage of it.
Wow. How proud you must be in working, and what a privilege and honor it is to be working with John and also Mr. Richard Clarke. Let me ask you as well, too. What is one thing, if you could tell briefly, what would be the one thing you would want people to take home with them after viewing this?
We look at the entire individual. We don't just look at the mental health issues. Yes, we are a mental health clinic, but we are promoting complete health and wellness, mental health, physical health, and as John was saying, reach out, take advantage of the services that are out there where you can get them all in one clinic and not have to go from spot A to spot B. We have some programs that we have in our clinics to promote health and wellness, like meditation, smoking cessation, physical exercise, nutrition, cooking. So we're hitting all aspects of the human being, not just one.
So do you cook yet?
Do I cook?
Yeah.
That's my specialty. That's what I do. I love it.
Favorite dish?
Anything Italian.
There you go.
Awesome. What a privilege and an honor. I just wanted to let you know it is speaking with you, and having somebody who has now obtained housing, is obtaining skills, therapy, counseling, primary care. What an amazing job that Magellan Health Services, partnering with many agencies, underneath them as well. Sponsored by People of Color Network, not just the plug, but really out of their hearts and really trying to get stuff out there. What a benefit it is to the community, and that's what we want to show is people like you, John, that are benefiting from this. And somebody like Richard Clarke and Magellan Services of Arizona, who is stepping out, doing something different, and making things happen. It's a miracle. I always say when somebody comes from an element of homelessness to an element of stability. Right. And that's just a lot of services with a lot of different people. We'll hear more from Dr. Richard Clarke coming back. Thank you very much, Mary, for coming. John, privilege in an hour. And we'll be back right after these messages, second half of the show.
Introduce myself to you. This is who I am. No more, no less.
Living with mental illness is a challenge, but it makes me stronger.
Some would say I'm crazy. I would say I'm enlightened.
Some would say I have a disability. I would say I have special abilities.
Some would say I'm far from ordinary, but I'd say I'm extraordinary.
1 in 4 adults are affected by a mental illness.
To learn more, visit oneinfour.info.
There's no stigma or discrimination against the heart, the liver, the kidney, even the gallbladder. Doesn't even have a job.
Yesterday, depression was kept in the dark.
And bipolar disorder was your best friend's mother's problem.
But the tide is turning.
We're stopping the stigma.
We're coming out.
Our goal is to make the discussion of mental dis-ease cool and trendy.
No kidding?
Me too.
No kidding.
Me too. No kidding.
Me too.
It's time we gave the all-American brain some peace of mind.
Spend all your time waiting for that second chance, for a break that would make it okay.
We are 100% committed to preventing suicide.
To feel not good enough.
We represent 100%.
We represent 100%. We represent 100%.
We represent 100%.
Oh, beautiful release.
We are people, so just think about it.
Before, addiction and depression kept me from living my life. Now, every step I take in recovery benefits everyone. For information and treatment referral for you or someone you love, call 1-800-662-HELP. Brought to you by the U.S. Department of Health and Human Services.
Sometimes adults say they're too young to understand. But young children are affected by traumatic events, even if they may not understand what happened. The great thing is, with help, children can get through these difficult events. Children can develop resilience. Help a child you know today. Find out more about the signs of childhood trauma at samhsa.gov/children.
Welcome back to Seeing the Need, Finding the Solution. We're here with a boatload of special people today. Dr. Richard Clarke, real quick question before I introduce the masses that have come on during the break. Last part of this story, we got to hear John a little bit. What was the best part of listening to his story for you?
Well, seeing John light up a little bit, talking about how he went from homelessness into housing now, and the stress that he was under trying to get his primary care needs met, and having them all in the same location where the psychiatric nurse, the case manager, the psychiatrist, the primary care doctor can meet together and provide complete care to him. I could just experience that in him as I was sitting here. It was just really nice to see him excited about being able to get all of his needs met.
Oh, look at your eyes. What a blessing that is. And speaking of stress, I now get to introduce 3 educated females as we're outnumbered here. Over here we have Shiloh. Shiloh is part of the clinical network. Shiloh Danley, nurse practitioner, doctor and PhD. Got your doctorate as well. We'll put all those in there as well. From Maricopa Integrated Health Systems, we have Stacey. Stacey is Stacey Littleton from Behavioral Health Nurse at Santan Clinic, and a special guest today, which is Hattisha Schrank, recipient of Integrated Home Health Services at Southwest Network's Santan Clinic. Welcome, all 3 of you.
Thank you.
I'll start with Shiloh over here real quick. Shiloh, what's it been like for you with this integrated home health care, these clinics rolling out where it's kind of a one-stop shop for these clients that get all these services in one place?
I think it's been a really incredible experience for me. Generally, you know, in medicine, we're kind of siloed between medical and physical needs and mental health needs, and being able to integrate that care together and really provide holistic and convenient care to my patients has been a great experience.
And what again, what that means is somebody who goes from to the normal, going to an orthopedic over here and a primary care over here and a psychologist over here, and what they've done is they've put that all in one place to help these clients and also to better services as well. Stacey, welcome.
Thank you.
For you, how's it been different from obviously different years in the past where everything was so separated? What's the one thing that stands out in your heart that has made a difference for you?
Well, I think as Shiloh alluded to, it's difficult when you're taking care of somebody with behavioral health problems. They tend to not take care of their medical problems. And the mortality rate of SMI, or seriously mentally ill patients, is very high with the, against the regular population. So for us to be able to just say, okay, this is what's going on with you mentally, and they can say, I'm not feeling well, but I don't have a medical doctor, I can just walk them right down the hall and say, this is Shiloh, and if you'd be interested, she can be your doctor, and you can come here for everything. And they're just like relieved, and they start taking care of themselves medically.
And real quick before I introduce Hattisha Schrank, how many clinics have you guys rolled out of these facilities to date?
We opened the first 4 clinics in May and June of this year. We're hoping to have 4 more clinics up and running in August, I believe. And Maricopa Integrated Health Systems and the clinics are working really hard for that. And by the end of the year, we hope to have all 20 clinics up and running.
Oh, wow. After over 14,000 health risk assessments and major amounts of research, major amounts of work and collaboration, meetings, it all comes down to people like Hattisha Schrank. Welcome, Hattisha. How are you?
I'm good.
We talked a little bit before the show. What it was like for you before you came into this integrated everything all in one place. So I want to know is how has it been beneficial? How has it mattered to you having everything together? How has that helped you?
It's benefits because you can have your mental health there and be able to have a primary care physician all in one spot. I'm a very shy, closed person. I keep to myself, so having everything in one spot where I'm used to seeing the same people over and over, I was more open to getting the care and the help that I needed.
And how proud you have been working with Hattisha, where you have that shyness in you, and coming on and being able to let other people that are in the same situation as you know that, hey, if you can do it, they can. You know, that's a real big blessing you are to be able to tell these people, because there's other people out there like you that are going through the same situations, that have the same type of challenges, and you're doing it. Yes. You're getting it done, and that is really, really neat. Hattisha, when you got to the new clinic, even though you've been involved with it, I guess, a while, what was your current state? How were you living? What was that?
I am currently homeless. I was traveling from people to people's houses, sleeping on park benches, wherever I could get rest at. My medications make me very drowsy, so it's kind of scary to be out at night and be on medication and not knowing, you know, what's going to happen. So.
Well, I'll put it in perspective on my end. You're homeless, and you're making it to your doctor's appointments. You're making it to get your meds. You're making it to get to your counseling appointments. You're making it to your doctor. What a blessing it is to have a company, to have that all in one place. Yes. And you're homeless, and you don't even have those luxuries or have those other things that most people have, and miss their appointments and don't take advantage of the services out there. And what a privilege it is to hear from you. Obviously, you meet a lot of people living homeless. I would take it as well.
You meet a lot of people. That look at me tell me I don't look like I have a mental problem or you know, something wrong with me. Growing up, I never thought that this would happen to me. I always thought, oh, that's other people, you know. Never thought a condition like this would affect me. But now that I know what I have and I'm getting the help that I need, I feel like I can help somebody else.
Speaking of that help, talking about agencies and like People of Color Network or Choices or anybody across the board, Magellan Health Services of Arizona, that help that you get in all those different areas, seeing the same people, that comfortness that you get too. What a relief that must be in those hours where it's 120 degrees outside. And what is that like for you when they see you and you walk in and you have that sense of peace?
That's what it is. It's a sense of peace. You know you're not going to get judged out when you come in there. You know somebody's going to be there to greet you, ask you if you're okay, if there's anything that you need, is there anything they can do for you. It's a warm, inviting feeling when you go in there. And that's very important to a person like me because I'm very shy. I don't really reach out to anybody. Stacey was the first person that I've ever really, really reached out to.
Stacey, what's this been like for you with Hattisha?
I can't even say enough. I am so proud of her. She was a challenge in the beginning to get her to come in and keep her appointments, simply because, first of all, it's hard to get a hold of her, being homeless, and because we had been there for her before in the past, she at least knew she could get a hold of me to help her when her medical crisis came up. She didn't know what to do, so it was me that she reached out to, and it just tickled me to death that I was there and she trusted me enough to do that.
And how neat for you must be when somebody picks up answers that phone for you, or finds a way to get contact with you. Yeah. How have you been able to share any of this with anybody else on the street?
I have the people that are in the park. I have a little group that we try to stay together to watch each other. So I try to share with them too. You know, they were looking for places that they can go to, or places they can find help. And I've mentioned Stacey and Shiloh a lot. I let them know the kind of help that I get and receive from there. They say they notice a difference when I come back to the park, and you know, I'm happy, and they say you look like you got like a sigh of relief on you. But it's just the warm environment that you feel when you go in there. It's like peace of mind, and you get it for a little while, and then your situation kind of goes away.
I'm going to go through each one of you, ending with Hattisha real quick. What's one thing, if you could tell anybody out there viewing today, that you'd like to have them take with them, what would it be?
This is the future of medicine. You know, putting mental health care and physical health care together and really providing holistic care.
Stacey?
Just that it's not separate anymore. Behavioral health and physical health is not separate anymore. That we are working very hard to integrate it so that a person can become whole 100%, and they know a place that they can go to get that and trust.
And Mr. Clarke?
Everyone benefits, you know, when someone like Dr. Shiloh can see the outcomes and the adherence and see the smile on the face of John and Hattisha and know that there's going to be someone like Stacey following up, or Mary following up with that person to make sure everything gets taken care of and coordinated. It's amazing, but that's not complete. And I think what we hear from John and Hattisha also is that, you know, helping individuals who face the challenges of serious mental illness means also taking a look at their housing and their employment needs. Recovery really means housing first and employment second, and we've got to work on those issues.
Hattisha, if there's anybody out there watching real quick and you want them to take one thing with them, what would it be?
If you have a mental condition and you're struggling with it and you don't know what to do, seek help, find help.
You are a complete blessing. All of you are. You're fantastic coming on here. And for those of you out there, what you can do is what Hattisha did. Pick up the phone, make a phone call, go to the websites on the information. If Hattisha can do it from a park, you can do it from your house. My name is Phil McIlveen. Thanks for tuning in.